Minister. Well, let's continue here tonight. The South African Health Products Regulatory Authority is appealing to the public to report any companies or individuals selling rapid blood tests for COVID-19. The body says none of the home testing kits in circulation are currently approved for use in South Africa. Let's discuss some of the concerns with self-administered rapid test kits. We're joined by SAHPRA's CEO, Boitumelo, Semete-Makoktlela. Good evening and thank you so much for your time. Firstly, what are these testing kits? Speak to us about how exactly they work.
Thank you for having me. So we've got two different sets of test kits. We've got the PCR test, which is where a healthcare practitioner collects the swab, and that's taken to the lab, and the PCR is conducted to detect if one has the viral infection or not. The second set of tests are tests that look for antibodies in your blood. So what antibodies are is what your body produces as it's exposed to this viral infection. And these antibodies typically take some time before they develop. So the caution we have is that with these rapid serological tests that use blood, we are saying that there is a place for those. So they do not work sufficiently for acute infection because they will not tell us if an individual is positive and therefore they must be quarantined and put on a clinical management program. So we run the risk of having many false negatives in the acute phase of the infection because the individual hasn't developed sufficient antibodies for us to pick them up. Later on, these tests indeed become relevant because you can utilize them for epidemiological studies. You can utilize them for population-wide studies where you want to see where people are exposed to the virus or not. And that's really the caution we have. The second thing is that these tests, when utilized, as the National Department of Health has said, there will be healthcare workers that will be having oversight and supervising these tests. So these are definitely not self-tests. They must be done under the supervision of a healthcare worker.
If the testing kit on its own has not been approved for use in South Africa, why is it available to people?
So as we said, if the public is aware of any tests that are currently available, please do let us know. They can visit our website and report such. As SAHPRA, we are working very closely with the National Health Laboratory Services. We're working very closely with the National Department of Health as we look to roll out scaling of the PCR tests and these community door-to-door tests. So whatever that they will be bringing in as our stakeholders, our key stakeholders, we are supporting that. And so it's important that whatever products that are registered, they need to be licensed by SAHPRA, please.
I imagine that part of the reason you've come out publicly is that perhaps you've gotten wind of some of these tests being used. So if you can speak to us about the scale, perhaps, that you suspect they may be available in the country and whether or not these products are being sold out of some black market.
Yes, and unfortunately we don't have, the sense of the scale of this, but we're getting a number of reports where the public say, I've come across this test, I've looked on the internet, this is what's happening, I want to get this test in or this test is available. And so we're saying, please do report that to us. The other thing as a regulator is that we work with other regulators across the world. So we can have a look at, is this test licensed by another international regulator or not? And so it is important that if people are aware of these, they need to report them to us, take a picture, send us the details of that test, and we will look into those.
All right, let's leave it there for tonight. Thank you so much for your time. And of course, that is the CEO of SAHPRA. We're going to take a short break. After this, we'll continue watching, of course.